Computer. Okay. Okay, so welcome back to the third session of the questions and answers that would be good for you all to know. Uh, if you're talking with friends or family as to why you're making the choices you're making. Um, Tried to be pretty broad and as comprehensive as we could be to, give you some of the basics. And as Scott pointed out, last couple of weeks that the questions and answers are on the website, so you can refer to them at any time. And so tonight, we again want to start out by asking to see if there's anybody who has any questions, anything that they have on their mind that they would like to share with us. Maybe they had some trouble with mm, falling out of the wagon at a holiday activity with a friends or family, and they're feeling not so great about it, or they're feeling like that's okay, it's no big deal. Anybody have any issues, any thoughts? Joan?
Um, I don't know if you've tried I think it's South Pine Bakery on Crescent. It's
uh,
Or it's a
I haven't, because I try to stay out of any food establishment that has the word bakery on it. It usually has food that I'm,
they do
that I can't hardly resist. But did they have something that was great?
they on their menu they identify plant-based options.
Oh, do they?
And I was in there the day before Christmas Eve, and they were running out of everything because they were going to be closed for a few days. And I said, they couldn't do this, they couldn't do that. I said, could you just make me a plant-based salad with whatever you had? And they said, sure. So they were very accommodating.
So it's not just a bakery, it's a food establishment.
Breakfast, lunch, and coffee is what they say.
I see. Okay.
Yeah. Yeah. So it's not just a bakery,
All right. Well, that's good to know.
but it's another option. And the people are really supportive of plant-based.
Well, thanks for sharing that.
Yeah.
Anyone else have anything they'd care to share? What was it called again? It was a bakery off of Crescent. What was the name, Joan?
South Pine,
South,
South Pine.
South like in north and south, and
Yeah.
pine like in oak and pine.
Yes.
Well, I'm curious. I came across, I go on all these things on the internet and everything. And
Yes,
this
Nancy.
what?
Yes, go ahead,
Yeah,
Nancy.
oh, okay. Yeah, I came across a a guy that said he was a functional medicine doctor. Excuse me. So I had never heard of a functional medicine doctor before, and I was just curious what it was all about, if you happen to know.
Scott, do you happen to know this one?
Yeah, it's just another type of kind of thinking outside the box a little bit. They go into, you know, there's specific types of labs and stuff, kind of trending toward the naturopathic route, um, but I don't know a lot of the ins and outs. But it's defined. It's one of the complementary medicine fields like preventative medicine, and there's functional medicine, and there's different types. But it's still different than lifestyle medicine. But it's kind of trying to break free a little bit from the just the regular allopathic, and thinking about mind, body, and other physiologic things in your body and how that relates to your health and stuff. So it's at least it's definitely thinking outside the box a little bit, which is good.
Yeah, well, I'm kind of disgusted with my doctor, and I don't know. I mean, the thing I have to say is that it's probably better that she's doing this to me, but she's probably doing it to all her patients. But um, because I know something about medicine. I'm a retired pharmacist, and taking the nutrition course. But I mean, any little thing, she prescribes me a medication. I had gone on a hike and then had my lab test, and my blood sugar was a little high. So she right off the bat sends me a prescription for metformin to the pharmacy and for a glucose meter. And I did get the glucose meter. I didn't get the metformin, but my blood glucose has been, what was it, 72 to 90, when I've taken it in the morning. And it's like, well, no, and my A1C was 5.5. So why in the world is she prescribing me metformin?
Yeah.
No talk about diet or anything, just sending me a prescription for metformin to the pharmacy. It's just like, that's crazy. But and she's all she wants to do is prescribe medicines. I had I guess I did a urinary test, she thought I had a UTI. I didn't have any symptoms or anything. And she wrote a prescription for antibiotic, and I go, hey, if I don't have any symptoms, I'm not going to go get this prescription. I mean, I don't want to mess up my body with antibiotics. So anyway, I'm just kind of, like I say, kind of disgusted with it. But I don't know what to do.
Eric.
Complain. What?
Did you
Eric
watch,
has his hand up. He's going to chime in a little bit.
It kind of reminds me of that movie What the Health, where they're just so disconnected from patient, really caring for the patients, and more that they're kind of really connected to the sick care system, which is exactly what we got to get away from.
I mean, I even went online on this UTI thing. I think maybe once in my life I've had a UTI, and I didn't do anything, and it went away after a week or two. But I mean, it was like, I don't have any symptoms. Why would I be taking a medication for it? If I even have one, I don't even think I had one.
So it's been my experience with urinary tract infections that it's very difficult to get a midstream or very clean catch urine for an adult or a child, as a matter
Especially
of
with
fact.
a female.
Yeah, especially with a female. And so what happens is some of the tests may be slightly altered, like there may be some white cells, which are not actually from the bladder, but from the vaginal canal. And it makes it look as though there's a urinary tract infection. So before treating someone, and if you don't want to be treated, but you don't want to have an infection that's going to progress to your kidneys, perhaps, then you want to insist upon getting a midstream urine sample, or at least culturing it to see if it has a bacteria that potentially could be a bad one for you. And so most doctors are so busy that when they get a report back and it shows some alteration of a typically totally normal urine, they're going to go ahead and treat that as a urinary tract infection. But some doctors are getting smarter about that and insisting that they, evaluate a little bit further. So if you're not having symptoms, good for you for questioning. And you could, have your doctor get a urine culture on you to see whether it really is a urinary tract infection. And if the report is negative, you're vindicated.
Well, I don't have any symptoms or anything. Why would I? I mean, this has been a month or two or something now.
Yeah.
3 months. So I never had any symptoms. So I'm like, okay, if I don't have any symptoms, why would I worry about it? That's
well, yeah, that goes back to the should we be getting physical exams? And Dr. McDougall talks about doctor mongering, and how we keep bringing the patients back in because we keep making diagnoses that may or may not be adequate. Now, I did a quick search on functional medicine because I'm not thoroughly engaged with what a functional medicine. I think of them also as integrative medicine physicians sometimes. They can be MDs or DOs. They could be naturopathic. Conventional medicine typically looks at prevention as synonymous with the early detection of disease. The idea being that early detection means a higher likelihood of successful treatment. Functional medicine, however, looks for changes that can be corrected long before a disease occurs. So when we talk about conventional medicine approach to the idea that early detection means a higher likelihood of successful treatment, Dr. McDougall makes a good argument for many cancers. They take a long time to grow, and by the time you can actually detect them, it's not early detection. It's 10 to 14 years down the road that you've been growing a cancer, and that would be considered a late detection. And so, your doctor is kind of hooked into what they learned in school, and maybe they'll expand their horizons as people like yourself question what they're doing.
Hooked into writing prescriptions. That's the way I feel.
Yeah, I was one of those that's guilty of it for my first 35 years. These classes, as I've joked before, are my penance for all the prescriptions I wrote for that never did much for diabetes or high blood pressure or those things. And so, it's hard for me to criticize the other doctors who haven't been lucky enough to have someone like Sanjay Gupta come along in their life and convince them that maybe they should do something different. And so Scott and I and Eric, we're all trying, and Kristen and the group of Eugene plant-based providers. I didn't name them all, but the ones I recently had contact with, we're all trying to spread the word and get people to do something a bit different.
Yeah, well, I just a few days ago got to download the How Not to Age, Dr. Greger's new book, and I'm over halfway through it. And he's saying with cancer, a lot of times it's better not to find it too early, because a lot of it, some of this cancer would just go away. It's not like you have to treat it right now. I mean,
Yeah,
unless it's bad. But
your body can actually destroy cancer cells, and so a lot of that is based upon your lifestyle choices.
Yeah. So anyway, it's an interesting book.
Glad you're
I think
reading
I'm going
it.
to have to buy the real thing instead of just listening to it, because I feel like when I'm listening, I kind of miss some things. So
Yeah, I'm like 80 pages into it, and there's a lot of detail, so I can't imagine
yeah,
trying to listen to it. So
yeah.
I'm taking notes and reading and rereading, and yeah, there's a
Well,
lot of detail.
I figure listening to it, I'm getting a good overview,
Yeah, good.
and then I can buy the book at some point and get down to the details.
Well, thanks, Nancy. Dave and Cherie.
There. At first, I want to say it was good to see Eureka crawling around there.
Yeah.
I missed her. Yeah, there. Anyway, I just want to say on the other end of the spectrum, my doctor has worked very well with me, and now I'm off both my blood pressure and cholesterol medicines, and I had my final cholesterol check on Friday, and he says it's normal. I don't think he thought I would get off of it, but he worked with me, and I'm off of it now.
That's awesome. You have a doctor that's willing to work with you. That's great.
Yeah.
Good work.
Yeah, we're thrilled to hear that kind of testimonial.
Yeah, the unfortunate thing is he's in his 70s, so I don't know how much longer I'm going to have it.
Yeah, so I being 75, think about that myself, but then I see that Dr. Esselstyn made it to 90. And so I say to myself, hey, maybe there is some tread on the tires, these old tires. And you know, my dad made it to 98 and a half. And so I'm still thinking that 25 years is still, that's a quarter of a century potentially at 75.
My
Now, we
dentist,
also see people who are kind of falling by the wayside in their 60s and in their early 70s. Uh, every night on the news, there's probably someone who's new who's in that age group. And so hopefully you've been convinced that by making some significant lifestyle changes for yourself, that you have the option to live a lot more years, a lot healthier.
yeah, I I think my dentist made it to his 80s, so
Okay.
hopefully I'll have a doctor another 5 years or so.
Yeah, convince your doctor to come to a class next week for my introduction, and he can get started.
Yeah.
Then you can have him for a lot longer. He'll feel well enough to keep seeing you as a patient till he's 90.
Yeah.
That's another point that I'd like to kind of make. And that is, in the old days, people used to go to the doctor. And I guess in these days, they still believe that they're going to go to the doctor. The doctor's going to give them their health through a pill or some recommendation that they make. Um, and, the modern world it's really the lifestyle choices that you make that are really going to bring you your health, regardless of what doctor you see. The doctor can give you advice. He or she can write a prescription, can even give you advice on eat healthier, like whole plant foods, move throughout the week, reduce stress in your life, get adequate sleep, get some social context. Don't drink yourself into oblivion or smoke yourself there. And yet, all that advice is really pretty meaningless unless you make the choice. Each of us taking the responsibility for our health is a message that our culture is not really promoted very well yet. And I think most of you who are coming to these classes are finding that, you have the option to pick and choose what you choose to do. You have that freedom. And that means that you have the freedom to bring yourself health or to actually encourage illness in your life. That's not to put guilt on anyone because they happen to wind up with diabetes or overweight or something like that, that it's all their fault. We have food that's pretty highly addicting, but it really does, if you want to crawl out of the hole, we can kind of offer you a hand, but you got to pull yourself out. And that's a message I've been trying to promote with the people I interact with. Boy, I'm getting long-winded here.
I can show does everyone know where the question and answers are? Since we won't get through them all, you'll be able to get to them on the website. I'll just show real quick where they are again.
Right.
On the class website. Here we go. So you just click on resources. So this is just livelifestylemedicine.com class website, and you click on resources tab here, and then you go to handouts from classes, the first one here, and scroll down. It's all the way down at the bottom here. End of class questions and answer document. So you just click that, and then there they all are, all the questions, and then below all the questions are all the answers to the questions, and with the links and things you can watch different videos and stuff. So yeah, we got through like 13. We got, let's see, to 18 or something, 17 or 18 last week before we had a guest speaker, and then but there's 30, like 35 of them. But yeah, we won't get through them all, but you guys can go through them too. And it's a good, this is the last class of the year. So it's a great review. If you've been to all the classes this past year, or if you're new to the classes, it's great to go through, and then we'll be starting the classes over again next week from tonight.
Thanks, Scott,
Yeah.
for sharing that. So we're going to open up again and see if there's anybody who has any questions or any thoughts. I see there's 3 chat comments, but okay. I don't see anything that's particularly a question here. But I'm kind of looking around the room just to see if there's anybody who has a question. No question. Okay, so we'll go ahead and we'll go back to our questions, and then we'll kind of come back and forth. We'll do a few questions, then close the screen down, or however it works. If you want to unmute yourself and speak up, that's fine. We're good with that. Whatever works for you. So we're going to go, oh, Susan, go ahead.
Okay. Yeah.
I was just curious. Sometimes you come upon studies in, and of course you got to look to see if how reliable they are. There was a study that came up. I don't know if you follow. It came out in the New York Times. The only thing I in the past I've trusted the New York Times kind of thing. And it was the title of it. It came out on, I think it was early December, and it says, it's a study about a low fat. It says, "Are low fat diet products really healthier?" And I don't want to go into it because I don't feel like I have the expertise. But it was very complimentary to dairy. Large studies, and they were saying but anyway, that's what I'm saying. Did you happen to see that, or is that something that
especially the high fat kind, or
right,
without being low fat, right?
Yeah. Any have you come across that article?
I'm not sure about that particular one, but I know there's a push for the school system to offer full fat dairy in the schools. And so it's in
the New York Times. It says, for decades, experts have said that less is more when it comes to dairy fat and health. But recent research has called this into question. And then they go into various studies and stuff. And anyway, I'm hoping that Gregor addresses it at some point. That's what I'm hoping for.
Well, he does address it.
Gregor
does address it, and he is pretty adamant about the fact that dairy is not a health food, that it's high in saturated fat, that a number of people don't have the enzyme to break down the sugar that's in milk, and that the galactose that's in milk is an aging kind of factor. There is the issue of IGF-1, insulin-like growth factor 1, which is a hormone that's in all mammal milks that stimulates growth. It stimulates the growth of a little cow to become a big cow in the form of cow milk. And it stimulates the growth of baby human for breast milk. There's IGF-1 in that also. And if you're drinking breast milk or you're drinking cow's milk when you're an adult and you have a cancer, an underlying cancer, there has been studies that show an elevated level of IGF-1 with cancer. So would you want to really put a growth hormone into your body that potentially could stimulate a cancer? Now, the people who write the articles for the New York Times or any of these are journalists. They are not dedicated healthcare professionals like Gregor, Bernard, if you read Physician Committee of Responsible Medicine or you go to their site, you'll find the problems, many problems with dairy. And McDougall, John McDougall's site, these are people who have been involved with actually the evidence-based science. Now, you can formulate studies that give the appearance that milk may be helpful. And we have spent some time, I can't remember which lectures it was, but we were more than happy to share how you can get confused and how the journalists can get confused because they see a study and it shows benefit, but the study's been manipulated by the dairy industry most often, or the egg industry, or meat industry. They can set up a study in such a way and alter the foods that people are eating to make it appear as though what they are promoting is the best option. Greger tends to break those barriers down. So I'd encourage you to just do a search on dairy at nutritionfacts.org. I know you trust this newspaper, and over the years, I've come to trust Greger's site, the Physician Committee for Responsible Medicine, Barnard's site, and McDougall's site. And that's what I choose for my health and the health of my patients. I don't know, I know a cardiologist who looks to journalists and is the keto doctor, the keto cardiologist, because that's where he gets his health information. And I'm saddened by that because of the people who come into contact with him.
Yeah.
Okay.
And that goes back to question number 1 2 weeks ago from the question and answer session. I think the very first question is, who do you trust when it comes to nutrition? And that's what Charlie was addressing there. So it's tough out there. That's why, and I have a whole class dedicated to, it's called Nutritional Myths and Other Popular Diets. And if you go back to the beginning of, I think it was in February of this year, you'll see the title of that class. You could watch the recording of that, and I kind of address some of those issues there. And that, because you can, like Charlie said, you can manipulate studies to, like, the control group is something even worse than what the dairy is. And so you can make it, look like, or eggs look healthy. Well, yeah, compared to, bacon and sausage, it looks healthier, or donuts, or you can kind of compare it to something that's even worse, and it makes it look better. So you have to see follow the funding. Where does who published the study, who funded the study, that all plays into it.
I truly understand your confusion about this, though, because, boy, it is confusing. You see one article one day and another article another. And so it really comes down to, who do you trust in this world? It's hard to trust a couple of guys who you don't know really all that much on the Zoom. We're no different potentially than anybody else on the internet. Of course, we've been doing this for 12 years, about each of us, and we take this seriously, but no one knows how seriously we take this and how important it is to us. They can't know that. But I want to give you a quick example of how you can manipulate a study, how you could make it appear as though maybe milk looks good. Let's take cigarettes as an example. You set up a study with 2 groups, and you have one group smoke 1 pack of cigarettes per day, and you have another group smoke 2 packs of cigarettes per day. And you look at the death rates and the rates of illness, and you determine that they're not statistically different. So what is your conclusion? Smoking doesn't cause disease.
Right.
You're right. If you just look at that one study and you look at the 1 pack versus the 2 pack, but if you take and you do a study and you set it up with non-smoker group versus a 1 or a 2 pack a day smoker, you find that there is a significant difference. And that study is correct. So the question is which one do you believe? One says that smoking is detrimental to your health if you compare non-smoking to 1 or 2 packs a day. And you have the other study that says it doesn't make a difference when you're comparing 1 to 2. That's how they set up the dairy studies and the egg studies, to make them look like they're okay.
Yeah, I remember one particular. Oh, go ahead.
Oh, go ahead, Scott.
No, go ahead, Nancy.
Then Nancy.
Oh yeah, I was on a trip. Oh gosh, what was it? I think that was last year's trip. But there was a registered dietitian on it, and her idea on good nutrition was everything in moderation. And I'm like, I mean, she wasn't teaching the whole foods plant-based, and so we've got whole industries that need to, not industries, but whole things that need to get their people, well, like the doctors, everybody needs to get online, get in line, and
I'm looking at.
Yeah,
do the right thing.
At the national diet, the American Academy of Nutrition and Dietetics, the dietitian authority in the country, at their national conference every year, they have the dairy industry sponsor. They have all their handouts are all sponsored by the dairy industry. So industry has their hands in their conferences and their education, just like Charlie and I had the pharmaceutical industry influencing our education. So it's industry has their influence in the education, which is why we had to kind of learn this nutrition stuff on our own outside of our medical training, because industry has. That's why we did the pill for every ill, because that's how we were trained. And so once you learn the nutrition on your own and and lifestyle medicine and all that, it's like, oh, okay, this is detached from industry. There's no profit to gain from eating beans and broccoli, and so there's no agenda behind it. It's just, this is the food that brings you the health, and the lifestyle that brings you the health. And so that's where a lot of that comes from. And that's why dietitians are no different. They were trained with the influence from the industries. So that's their experience. Unless they break free. And then there are lots of whole food plant-based dietitians out there. And we have like 6 of them on our Eugene plant-based providers, luckily.
So Nancy, there is hope. And I agree with you that the training needs to be done. Back when I was transitioning about 12 years ago, I knew of one plant-based registered dietitian in the state of Oregon. And now Scott says there's 6 in just our local area. It has been changing, but there are still a backlog of a number of registered dietitians who have had the old training, not based upon the science in the last 10 years, who they continue to practice. And it's hard for someone to understand that they need to, expand their education base. They don't want to have to go back to school again. But this is a lifelong learning process for those people who are really going to be helping their patients.
Well, I just read somewhere where, I don't know, you guys might have seen it, in the state of New York, for doctors, on their continuing education, they're going to be required to do a plant-based nutrition course.
And that's thanks to Eric Adams, likely, and the Physician Committee for Responsible Medicine has been pushing for that. So kudos to them for getting that. We do need that throughout our whole United States. I saw that article last week.
Oh, you did? Okay. I was just curious.
Okay, Joan.
I'm asking for advice post holiday. So there have been all the sweets and, temptations of the holiday. Would you recommend going into the new year a fast and then going, strictly back onto a good diet, or just go onto the good diet?
For me personally, I'm a good diet person. I don't like to fast. But but for someone who is having difficulty, um, going back or whatever it is, if they're too conflicted, then maybe a fast might work. What do you think, Scott?
Yeah, as long as it's 24 hours or less, anyone that tries to do anything more than 24 hours needs to be monitored by their medical provider, because especially with medications, and then even someone that's on blood pressure medication, diabetes medication, probably shouldn't fast unless they talk to their doctor, because your blood pressure could drop too low, your blood sugar could drop too low, so you got to be really careful. But I would just say, yeah, without medical supervision or consultation with your medical provider, I would just say, just get back on track as fast as you can.
Remember,
that,
this is a
yeah,
lifetime. We're not talking about a week or a month of what you're going to be doing here. You're talking about eating healthy for the rest of your life, basically.
Okay.
Does it
Thanks.
mean that you are going to make a healthy choice every single time until the day you die? It doesn't mean that. It means training your brain to have foods that are around you that are healthy choices. It means, figuring out ways when you're traveling how you're going to get enough healthy calories in. But it may mean that you may be eating some foods that are yellow light foods or even red light foods or red boxed on a rare occasion without it just completely destroying your health.
Okay. Thank you. That's helpful.
That's quite a change on my part, huh, Scott, from a few years ago.
Yeah, that's good.
All right. Any other questions from, I was going to say the peanut gallery, but it's not really the peanut gallery, it's the gallery. If not, we're going to go back to the questions. I don't know that we got to one question yet.
Yeah, we did.
So here we are. We did TMAO, I believe. I had number 18. Did we do that? Or did I do that this afternoon?
Oh, did you go over some of these this afternoon?
I had another video that I went over this afternoon, and we talked about TMAO.
Yeah.
Let's see. I think we talked about nitric oxide briefly.
Yeah, we did. I think, yeah, we probably are at 18. Anyone here last week, did we talk about TMA already? Or do you have a question about it?
Okay, so let's go over TMAO because some of the people may not really understand it. Ken, you raised your hand. Go ahead.
Okay, you just mentioned nitrous oxide. Yeah, we talked about it last week.
Nitric oxide.
Nitric?
Yeah, because nitrous is when you go to the dentist, they don't give you some IV other medicine. You put a mask on it, it's nitrous oxide as opposed to nitric.
Yeah, and nitrous oxide
Yes.
is what race cars use.
Yes.
Anyway, nitric oxide. So it's leafy greens. I got a question. I may have asked it already. So Brussels sprouts and cabbage and broccoli, they're not leafy greens, right? Do they have this nitric oxide? I think you said no.
They're cruciferous vegetables, which I don't think they have as much nitric oxide as the dark green leafies. The dark green leafies is what you're looking for.
So since that meeting, I've started chard, which I've never had before.
Yep.
And then instead of using any lettuce at all, I'm using chard and kale and I eat so many collards cooked, I'm not going to put them in my salad.
Okay.
But
how about romaine? It's green.
Romaine?
Yeah.
Is that okay?
Yeah, it's a leafy lettuce and it's individual and it's not like head lettuce.
Huh. Well, I love that stuff, of course.
Well, if you love it, then add it to your life. We don't want you to be deprived.
What's bok choy? It's that little kind of onion looking thing, right?
Yeah, it has kind of a white at the base, and then it has a green leaf. And bok choy is used in, I don't know, when you go to eat Chinese food, is what comes to my mind. It could be Thai food, I imagine. Bok choy. It's in stir fries.
Is that going to be a green leafy, or is that closer to the Eliums?
I don't think I haven't heard of that. It has some dark green leaf with it, but I think the other choices are probably a little better. The collard greens has good calcium in it. Arugula is a choice, which has a peppery taste, and I think you might like it. Do you like arugula?
I don't know that I've had it, but
Oh, you got to try it.
I couldn't find it today at Fred Meyer.
Okay, arugula. You want to try it? I eat half a handful every day with the collard greens and
arugula and
arugula.
Arugula. All right. Thank you.
You're welcome. All right. Anybody else?
I just put in the chat. You can look up any. It's Dr. Esselstyn talks about a vegetable's ORAC value, ORAC. That stands for oxygen radical absorptive capacity. And just look up on the internet, vegetables ORAC value, oxygen radical absorptive capacity, and just try to choose the ones that are the highest. But there's a whole long list of them, and that's what the higher the ORAC value, the more nitric oxide will be made when you eat it.
Do you have a list there? You could call out.
I just put the. Oh yeah, I could look it up, but yeah, it's the thing that Dr. Esselstyn rattles off like 15 to 20 different.
Yeah, he does 15 or 20.
Greens.
It's pretty cute. He's got a little song that he's able to do.
Charlie, while he's doing that, can you tell me that ORAC, spell it out, or
it's in the chat?
Oh yeah,
I wrote it out in the chat.
Are you able to get to the chat, Ken?
I'm there.
Oxygen radical absorptive capacity.
No,
there's all kinds of things here. Even beans have a lot of high ORAC values.
Okay. So what does it say?
I'm just looking through a whole bunch of different ones here. I haven't even found the
dark green leafy.
Yet. Just going through everything.
But so it mentions radical. But the main reason we're interested in this nitric is
because it relaxes the arteries.
It dilates arteries.
So that improves blood flow to your organs.
And it is also
helps your arteries heal.
When I see the word radical in this, I'm thinking free radicals. So they're completely different thing.
No, it's the same thing because it's oxygen radicals, absorptive capacity. So it's trying to it's the antioxidants, basically.
It combines with the free radical. It's able to donate electrons so that the free radical doesn't cause the oxidative damage.
So like, for example, spinach has a ORAC value of over 1,000. Romaine lettuce is 396. So it shows you how much more spinach has than romaine lettuce, because think about how much darker green spinach is compared to romaine. But it doesn't mean you can't eat romaine, it's still good. But anyway, we don't want to spend too much time on that. It's okay. Just eat lots of green leafies.
Okay, here we go. I'm sure, get back if we need to. So we're back here. to TMAO. So trimethylamine N oxide. And let's discuss that briefly. Trimethylamine N oxide, if you're eating, it's generally meat or eggs. It has carnitine or choline in it. And when you're eating foods like that, you're actually promoting the growth of a certain kind of bacteria. Dr. Greger calls them Bacteroides. Now, Bacteroides bacteria produce this chemical called TMA, trimethylamine, which gets converted in your liver to trimethylamine N oxide. That trimethylamine N oxide is a chemical, it causes irritation, inflammation, and actually helps push the LDL cholesterol into your arteries so that you develop plaque. Well, if you're eating plants promote the growth of Prevotella, a different kind of bacteria in your large colon. So as it turns out, these Prevotella, they don't produce TMA, they don't produce trimethylamine. And so you don't get trimethylamine N oxide, which is causing this inflammatory response and pushing the LDL cholesterol into your arteries. So you don't develop the plaque like you would if you're eating the meat and eggs. And so, you know, it's your choice. You get to populate your microbiome with whatever bacteria you like, but if you actually know the science, you may choose to populate it with plant bacteria, and you'll have less heart disease. Maybe you won't have any heart disease like some countries or communities. All right, that's the TMAO issue, and you can look down and there's some videos on it, or at least one that you could look at and learn more about it. Unless you have questions now, we'll get to it in a moment. Butyrate signaling. You know, butyrate is a chemical that is produced by your good bacteria. If you are eating a lot of fiber, you could produce a lot of butyrate. That's the good bacteria in your microbiome produce this chemical, butyrate. Butyrate is anti-inflammatory, and it also can send a signal back to your brain that you've had plenty to eat and you're no longer hungry. If you take away the fiber in your diet, then your body is not getting the signal that you've had enough to eat and you're always hungry. I used to be this way. No matter if I just had a big meal, I was not eating enough fiber. And so I would always eat. Even if I just eaten a meal, I would eat any donut or cookie or cake that was in the emergency department break room. When I became totally whole food plant-based, I got the signal that I had enough to eat. I became full. I had enough bulk in my diet, and I had the increased butyrate. And now I no longer have those cravings that I used to have between meals. So there are other advantages along with butyrate in your microbiome. You eat enough fiber, and you will actually get enough serotonin, perhaps, so you won't have anxiety, depression. Maybe not have to take those anti-anxiety, antidepressant medicines that so many of us in our country are taking. Probably related to our diet to a good extent. And then the last issue before we take a quick break here to see if you have questions is the oils. You know, you read one study that olive oil is the greatest thing since sliced bread or whatever. And, you know, it goes with the Mediterranean diet. Mediterranean diet reduces heart attack risk. And yes, it does compared to the standard American diet, but it's the fruit and vegetables mainly that are the benefit. And the oil has some side effects. The oil coats your red blood cells and causes a sludging or a slowing effect of the blood. So you get decreased oxygen to your tissues. And the oil can also cause an inflammatory effect, not allow your arteries to relax. So it raises your blood pressure. So if you have high blood pressure, if you're cooking with oil, that includes olive oil and hot oil, even though they're considered healthy oils, they're still causing this problem in the arteries, which raises your blood pressure, which is not a healthy thing to do. So be careful about adding oil. Some people are going sugar, salt, and oil free. That's SOS, free, which makes a whole lot of sense if you want to try to reverse high blood pressure, if you want to reverse um,
diabetes, heart disease.
Diabetes. Yeah. Go ahead, Scott.
Yeah. And then the other thing about what I like to always say about oil is that's the same issue we talked about earlier with studies. So olive oil, you can there are studies out there that show olive oil is healthy. And you say, well, okay, it's healthy, but compared to what? So when they put it head to head against coconut oil or trans fats or saturated fat, it's better. And so it does reduce risk for heart disease and high blood pressure and all those things, but only compared to something that's worse. And so it's not a health food in and of itself. You're better off just eating the whole plant foods, the olives, the beans, the whole grains, the fruits and the vegetables, and leaving the oil out. But if you do a study and show, well, would I be better off switching from the trans fats or the saturated fat or the, like a coconut oil, for example, to the olive oil? Yes, that is an improvement. That's the direction to go. But we're trying to tell you that doesn't make, two wrongs don't make a right, that's that kind of thing. So it's just a processed food. It's been stripped of the nutrients and the fiber and everything else. And so it's not a health food, but it is better than some of the alternatives. And that's what the studies show, because that's what they compare it to. So that's just another example of what we were talking about earlier with designing studies that can make something look good. And again, a lot of those studies are funded by companies that make the olive oil. So
all right. Any questions so far for either of us? There is in the chat one question. Arun.
Hi, I'm just eating arugula here. But I wanted to say, when Scott said olive oil is not good compared to some things, good compared to some. And so I just wanted to give an example that probably olive oil is better than lard.
Yeah.
Definitely.
Yeah, we would all agree to that.
Thank you.
Dottie.
Oh, yeah. Okay. No, I just wanted to add one thing, that
okay.
Whenever I feel like I need arugula, I go to my garden and there are 20 or 25 plants of arugula that I just, harvest arugula and bring it to eat. So it's good.
That's great. Yeah. Many Americans used to grow a lot of food in their garden. They don't do that as much these days.
Okay, yeah.
But good for you for doing it.
Thank you.
Dottie.
Well, I wanted to say thank you, Charlie, for the way you explained that, because I've been struggling with like the no oil and have been conditioned to believe that oil, olive oil is the better oil and all of that. And what you just said about it coating the red blood cells and making it sluggish, or whatever the word was you used, it's like that gave me an aha moment. So I just want to say, and I have blood pressure control, but I've been trying to get off my blood pressure medication. I've been trying to cut down on oil, but I think you just gave me the key to really make a difference. So I just want to say thank you for that.
You're welcome.
And do you have that video in the answer to the olive oil?
Was my thought exactly. And so we're going to go and we're going to find it, because I wonder if it's down at the bottom, if it's.
You stopped the recording. Oh. Oh, where did Charlie go? Oh, there, you're muted, Charlie. I don't know what you did. You're muted, Charlie. You did something. Can you guys still hear me?
Okay, I can hear you
Yeah,
now.
there you go. Okay.
Okay, I don't know what I hit.
You hit stop record and then you hit start record again.
Did it start?
Yeah, it said recording stopped, and then a couple seconds later it said recording in progress. So somehow you clicked ending the recording, and then it started back up again.
All right, whatever. We've been doing pretty good with that, but I guess it's not a perfect world. I'm going to go back to the share screen. Is it on the questions or not?
It's on the. I think it's on the. I think you had that video on the answer to the question. I seem to recall from previous.
All right, so let me go back to it. And I'm going to go, can't remember, it must be 19 or something. No, 18.
No, it's 20. It's 20,
20.
Right there. Blood sludge, blood flow before and after eating a meal right there, YouTube.
Right here?
Yeah.
Okay. Let me play it. How come it's not playing? So I'm going to do control, skip the verification.
3 surprising reasons why you can't go to the bathroom. Number 1, you're eating tomatoes. The skin and the seed of tomatoes contain a
How come that's not playing? Well, I don't know what happened to the sound. So what I'm going to do is I'm going to X out of here. And I'm going to go to minimize this and go back to my thumb drive. And then I'm going to find that video. And it's under the tip class. And I think it was under number 9. Maybe 8. That's hypertension. Number 8. And where's the sludge? I think that's this one here.
Representation of what when you eat.
That's when you pull out the clogged arteries. That's
This
when
is
you
a
pull out
dramatic representation of what.
Oh no, you're right.
When you eat a high fat.
Okay, so here we go. This is what happens when you eat a high fat diet.
Meal, whether it's vegetable fat or animal fat. Initially, the blood cells that.
That's whether it's vegetable fat or animal fat. That means the oils in your diet.
They flow by each other very smoothly. They actually repel each other, the cell membranes do, and you have this rapid, effective blood flow throughout the body. Then you eat the fat, vegetable or animal fat, goes through the gut, into the bloodstream, coats the blood cells, and now they hit, stick, clumps, sludge, and now you have ineffective circulation. This affects the whole body. You feel sleepy and sluggish. People who have narrowed heart arteries, they get chest pain. This clumping and sludging causes the blood pressure to go up. And it continues, this sludging, for about 10 to 12 hours after you eat. And finally, after about 10 to 12 hours, the blood starts to break up, and we then have normal, effective circulation.
Boy, that was shocking. I'll bet my...
You have normal, effective circulation until what?
So you eat your next meal.
And then you sludge again. And slow it. Go ahead, Nancy. Unmute yourself, though.
Yeah, somebody was talking about the oil, and well, about the same time that these two things came together. but I just got tired of my pans getting all kind of brown, you know, when I was using the oil to brown the onions and so on and so forth. And then I heard about water saute. So that's what I've been doing now. So my pans are nicer, and I'm sure my blood vessels are nicer. So it's all two things at once.
So water saute is definitely a expert choice, and so is vegetable broth can be used for sauteing also. You don't need to use oil. Okay, let's go back to our questions, and let's see if I can find where we were at. I think I can find where we're at. And we're back to, I don't know.
21, I think.
Like, yeah, 21. Are there special considerations when cooking garlic and broccoli? And what about flax seeds? So let's talk about garlic first. Garlic, when you chop it up, there is a chemical, I think it is alanine, and there's an enzyme that converts that alanine, I think it's alliinase, to allicin. Allicin is the compound that's active in garlic that boosts your immunity, fights off cancers, those sorts of things. So if you chop up garlic and you throw it immediately into the pan and saute it, and you heat the enzyme up and destroy it, so it can't produce this allicin, and you lose the benefit of eating the clove of garlic that you may be eating. That's why I eat mine raw in the morning. Now, there is another technique. You could just chop up garlic and let it rest for about 15 minutes. And then you could heat it up if you like heated garlic better than raw garlic, and you'll be just fine. So if you don't have that cooking technique down, think about it. And there's a video on it, I believe, down on the answer about this. Second strategy to cooking broccoli, and then there's one about cooking garlic and flax seeds. So now it's a similar issue with broccoli. Broccoli, when you chop it up, it has a chemical, I don't know, it's glucoraphin or something like that, and it gets converted by the enzyme furosinase to sulforaphane. It's taken me many years to think about those terms, and I've been trying to learn them, and I still have a little way to go. But nonetheless, if you chop up broccoli and let it rest before you cook it, you have to wait 45 minutes, according to Greger. I think it's about 45. Well, that's a long time to wait. And so most people if they want cooked broccoli, they cook it up, and so the enzyme gets destroyed and they lose the sulforaphane benefit, anti-cancer, immune boosting chemical benefit. But there is a trick that Greger has shared with us, and that you take a pinch of mustard powder and you put it on your cooked broccoli, and that mustard powder has the enzyme, so you'll get the full effect of broccoli. This is important for you to know if you're depending on broccoli to bring you some additional health. And then there's the issue of getting your omega-3 from flax seeds. If you just eat the seeds and swallow them like they're in the bread and they haven't been crushed up, the omega-3 stays within the fibrous coating and you don't absorb it. So you have to crush the seeds, and that becomes flax meal when you crush when you crush flax seeds up, they become flax meal. And so if you buy flax meal, you need to refrigerate it because it lasts about a month in the refrigerator. I've been told by Gregor, or he's told us, whereas the seeds can last for months on your counter and you can grind them once a day. About a tablespoon worth is a good starting point for most people. Some people can get by with a couple tablespoons, adding, some chia seed, half to a tablespoon to the flax seed. Some people like to do that, but the flax seeds tend to have the most omega-3s. Any thoughts about that?
Hey, Charlie, it's Kristen. I just wanted to remind everybody that that same concept with the chopping garlic also applies to onions. The chemical that's released, it needs a little bit of time for it to be released from onions. And so in that book, Fiber Fueled, he talks a lot about that you chop, then stop. So it's like an easy little reminder, chop, then stop. And it's about 10 minutes that you want to leave onions alone after you've chopped them up before you cook them.
Thank you for reminding us of that. Appreciate it, Kristen. Arun.
The flax meal, after you grind it, can you cook it, or do you want to put it raw on your, whatever salad or
you can cook it. It's my understanding you can cook it or you can have it raw, whatever you choose.
Okay, good. Thank you.
You're welcome. Any other thoughts from anyone? All right, let's go on to the next. Go back to a share. Side effects of calcium. Oh, wait a second.
We're at 22.
Oh, wait. I got allium group and cruciferous group are best at fighting what? Anybody know? Care to take a guess? It's a kind of one of the, I think it's second cause of death, approaching on the first cause. Getting close to heart disease is the first. Second cause, cancer. So the allium group, which is onions and garlic and leeks. There you go, onion, garlic, leek. And then there's the cruciferous group, which we've talked about, which is the broccoli and cabbage and cauliflower and a whole bunch.
Brussels sprouts.
Arugula. I think collard is a cruciferous.
Cabbage.
Cabbage, very good. Okay, those are the best anti-cancer or cancer-fighting foods. Arun, go ahead.
What about, turmeric roots and ginger?
So those are good for inflammation. So they're good anti-inflammatory. Ginger might have some immune boosting effects. I'm not sure. But
looks like that's question number 26.
Oh, okay. We'll wait till that then.
Oh, okay.
But good.
But somebody had told me that they vouch for turmeric because it took away her breast cancer tumors.
Well, the anti-inflammatory effect may have had a significant effect on her.
Okay.
All right. Nutritional yeast can add what flavor to your meals? Anybody know?
B12.
Well, some nutritional yeast has B12 in it, but the flavor that you're looking for, Marcia, go ahead.
How about cheesy flavor?
No, I just had a quick question. You can get garlic in water in those things, cases, Is that any good, or should you just get the whole bulb and crush it that way?
Garlic in what?
Well, it comes in a small bottle. It's a clear see-through bottle, and it's in water.
It depends on whether they've heated it up and cooked it or not.
Well,
It
I
depends on
understand that,
how
but
it's. So you need to call the company and
oh,
said, how is this processed? Have you heated it up, or is it just in its natural state and not been? It may also be protected because the cell wall has not been broken, so you wouldn't necessarily have the enzyme exposed. But I don't know the heat to heat that up. I don't know. It's a good question. We don't know every answer to everything.
I will call and find out if I can and try to get back to you.
Good. Sounds great. Marcia?
Getting back to what helps with inflammation, along that line, what would help with headaches?
With headaches?
Yeah.
Yeah, so I guess it depends on what the headache is all about. And, the headache could be from tension, muscle tension. So it might be stress release, meditation, yoga, walking. That may reduce a headache as significantly as any food might. I don't know of a specific food that actually treats headache. I've been in the habit of doing Tylenol if these other maneuvers that are related to stress or
Gregor has some videos on ginger treating migraines specifically. There's some studies on that, but yeah, headache is a very complicated diagnosis because it could be from a medication you're taking. It could be because your blood pressure is too high. It could be because you're stressed. So headaches should be evaluated. Evaluate if it's a chronic recurring headache by your medical provider. But yeah, there's lots of things that foods and stress relievers and stuff, depending on the type of headache, that could be helpful.
But the ginger is probably a good idea if you've had a full workup and that sort of thing. No one seems to find anything. Then you could consider giving that a try.
Okay, I will try that.
All right.
Thanks.
All right. Let's see what else. We're going back to sharing, and we're at nutritional yeast has a cheese-like flavor. So you can put it with popcorn. You can put it on your spaghetti. You can put it on whatever you choose to put it on. And usually when you first start using it, I know when we didn't use very much. And then once we got used to it, we used enough that we could actually get more of a cheese-like taste. Not everybody feels it's that great, but give it a try. Vitamin B12, vitamin D3, medium chain, long chain fatty acids. What about supplementation? Are you supplementing with B12? If you're not, boy, we encourage you to start. And if you're under age 65, you only have to do this what? You only have to do it once a week, 2,000 micrograms once a week of vitamin B12. And there are a couple different forms that are commonly sold. One is cyanocobalamin and one is methylcobalamin. And so the studies that have reversed vitamin B12 deficiency have used cyanocobalamin. I know some people like Dr. Clapper, he uses methylcobalamin and he seems to survive. And I know I didn't know much about this, and I used methylcobalamin for about my first 6 years until I read The Science Closer by Gregor and decided to change over to cyanocobalamin, and I've survived it. So I think you could survive with either one of them, but the scientific studies have been on cyanocobalamin. And if you're over the age of 65 or older, you may, Dr. Gregor recommends 1,000 micrograms every day. because you don't get as good of absorption, and on the details go. Yes, Nancy. Go ahead, Nancy, you can unmute.
I always forget about the stupid mute thing. It's better absorbed through the mouth. And so putting the drops under the tongue or the lozenge in your mouth so that you can better absorb it that way. But it still works if you swallow it too.
It does still work if you swallow it. You know, you're taking a high enough dose that whether you swallow it or whether it's under the tongue, if you swallow it, if you're taking small amounts, if you don't have enough intrinsic factor that's produced in your stomach, then you may not absorb it, but you're taking such high quantities, it diffuses through. And so you'll get enough whether you have enough intrinsic factor or not. If you're doing 1,000 a day, if you're over 65, or 2,000 once a week. Okay, the other is vitamin D3. If you get out in the sun, you get enough sun, you live in Southern California or in Mexico City or wherever along the equator, you probably can get enough sun. You're living up in Oregon, most of us are wearing clothes and are covered up. Hard to get enough sun. So Dr. Greger recommends for those of us living in this area to do 2,000 international units once a day. I don't know. You know, if you want to check it, you can do levels, which are sort of borderline as to whether they're, you know, accurate. And you want to have a level that's over 30 if you're checking it. And I just take 2,000 international units a day just because. DHA, EPA, there's some controversy about whether you need to take it or whether you don't. We know we need this. Many will say that we're able to convert the short chain fatty acids or omega-3s into medium and long chain. And some people say as we age, we may not be able to do it as well. In order for you to get enough DHA and EPA, you have to eat a pretty significant quantity because they've done tests on spinal fluid analysis. This Veg Source, I can't remember what his name is, but he just came out with a video about it again, about how, you know, DHA supplements are being promoted, but they're promoted in amounts that may not be enough to actually get to the brain or central nervous system. So you may want to hedge your bets and take some, or you may want to just wait and see what the science has to say. That's what I'm choosing to do. But whatever you're comfortable with, you can choose to do. We can go over that more on an individual basis. There's just a few more questions here. I'm looking through them. Like, what spice reduces inflammation? We talked about turmeric. What is the whole grain 5-to-1 rule? Do you all know what that is? If you are looking like at a whole grain bread, it says 100% whole grain. And it says on there, the fiber is 1, or let's say the fiber is 3. Well, you multiply times 5 and you get 15. The carbohydrate should be no more than 15. If a white bread has like 1 gram of fiber and 20 carbohydrate, so 1 gram of fiber times 5 is 5. Since it has 20 carbohydrate, is way outside the rule of it being a whole grain. There are a lot more breads these days that are whole grain that meet the rule, the 5-to-1 rule. 5 carbohydrates to every gram of fiber is the maximum carbohydrate that you should have. I don't know if you all got that or not, but if you didn't, all you need to do is go to the video on number 27, and I'm sure it will be there. Significant of IGF-1, we talked about. Do meat, dairy carry contaminants? And you may want to review that, especially since we had that other question about dairy and how healthy it supposedly is according to the news people. But there are PCBs, dioxins, mercury, cadmium, and lead are all concerns. So you may want to check this out. And then let's see, what else? Antioxidant power, berries among fruits and veggies. And this is one that I'd really encourage you all, if you haven't seen it. It shows that if you're eating what most the standard American diet people eat for their fruit and veggies, they don't get a lot of antioxidants. And so looking at the various choices may be helpful. I always like to play that video, but it's down here. Let me see where it's at. It's under, I don't know. I don't see it here. We have a class on it at some point in time, so we'll be going over that again pretty soon with our next class. So just stay tuned when it comes to antioxidant power among fruits and vegetables. You can get if you're eating the colors of the rainbow and you're eating a serving of berries, like blueberries or strawberries, you're probably going to get a fair amount of antioxidants. So don't just stick with bananas. Apples are pretty good sources of antioxidant, but berries are really a superhero, and beans are pretty good also. What's the cause of diabetes? We've talked about many, many times. It's the fat, it's not the sugar. Should we be avoiding carbohydrates? We've gone over this so many times that, I hope you know the difference between simple carbohydrates and complex carbohydrates. And if you don't, then stick around for our classes this coming next year. What's that, in a week from now? What toxin has been found in rice? And that's arsenic, if you don't know. So we buy our rice from California. The Pleasure Trap by Doug Lisle is, I think Scott has it listed where you can watch it, a video. And then how do you transition what you choose to eat? There's Gregor's Daily Dozen app. There's Physician Committee for Responsible Medicine as a Kickstart free program. If you want to pay some money, McDougall has an online program where they help coach you in cooking at home and other things. And I think that's probably all we need to say. We want to make sure that we haven't left out any questions. So let me go back to the question room and see if Scott has anything that he wants to add.
Oh, that's just a reminder. You can go access those off the website for people that maybe came in a little bit later tonight. That is under the handouts from the classes on the resources list for the on the class website. So if you want to check those out and watch some of those videos and stuff, you can do that.
Okay. Any questions? The room is going to be back to this. I'm going to go back to the gallery see if there are any hands from anyone. You know, this is the last class for the last, at the end of the year, last chance to get that question in, should you be interested. I'll run.
Okay, so in winter, like now, what fruits and vegetables would you, that are available plentifully, would you recommend for best health?
For me, berries every day. 4 servings to 5 servings of fruit every day. Vegetables, as close to half a plate as you can get for the day. And then 3 servings of whole grain, 3 servings of beans or lentils that are half a cup as a serving, a few, a tablespoon of flaxseed. I tend to follow Greger's Daily Dozen. So if you're following Greger's Daily Dozen, you're likely getting a healthy diet. But not everybody likes the same foods that I like, so it's hard for me to tell you the best options here.
Right, right. I was thinking in terms of, like winter specific foods or fruits or vegetables that would be recommended, Yeah.
It kind of depends on where you live. You can kind of get everything gets shipped in, so you can kind of get everything.
Right.
Almost everything you get in the summer, you can get in the winter these days. But if you don't have access at your grocery store, you could always go with frozen. Frozen berries, frozen fruit, frozen chopped up veggies.
Yeah, and there are,
like.
Scott, there are some fruits or things that are in season now, obviously not here, in other parts of the country, like oranges, citrus, pomegranates. I'm often seeing a lot of these on special in the grocery stores. So you can also look for those that are in season in other parts of the country, and like Scott was saying, that we're getting shipped in.
Yeah. How about, like pomegranates or oranges?
Yeah.
Do we recommend those for all the good qualities there, Charlie or Scott?
Yes,
or
absolutely. I am eating pomegranate every single day. I bought them at one market. It's $4 for pomegranate. At Walmart, they're $2, and they're just as good. So, we eat 2 or 3 pomegranates a week.
Okay.
We're also eating broccoli every day. We're eating a little garlic. We're eating a little handful of spinach, half a handful of arugula, collard greens. We love those things. We're eating beans and groats and oatmeal every day.
Yeah, and squash tends to be a really good vegetable that it can last for a very long time. It doesn't tend to go bad. So using butternut squash, acorn squash, spaghetti squash, those are all really good options in the winter also.
What about celery and eggplant?
Eggplant is great. Celery doesn't have as many nutrients, but it's still healthy. It's got plenty of fiber, so it's great.
Well, no, of course, celery I get for fiber.
Yeah, it's good. Good choice.
Right. Okay, thank you.
You're welcome. Edward.
So I'm on my computer a lot, right? My fingers get really cold when I'm typing, and that's like one of the worst things. Is there anything I could do or eat to, I guess, promote better circulation so my hands don't get freezing?
You can put on a thin pair of gloves, which will keep them warmer. But if you want to improve blood flow, you'll get your best blood flow if you're reducing or not eating the oils that are processed oils, that is. and if you're eating more dark green leafies for the nitric oxide, that improves blood flow. So I don't know what you're eating now, but eat a few more greens. Eat a bit less of that oils that you may be taking in your foods, and see if that doesn't improve things.
Okay. Thank you.
Anybody else? Scott and I have, I know I have enjoyed, and I'm sure he has too. He's been just like, he's right here every single week.
Wow.
We both have loved sharing this time with you this whole year. We're very appreciative of you all.
Hope you join us next week.
Is he on there still?
Susan.
Oh, there he is.
Did you put your...
I did.
Go ahead. You're unmuted, Susan. Go ahead.
Yeah, I just wanted to say, the guy was wondering about the cold fingers.
Dr.
Weil.
I know for cold feet, he suggests putting a little like red pepper in your socks or something to increase circulation. And I suppose that could work with hands also. Anyway, that was his. He recommends that.
Well, that's an interesting thought. I haven't ever seen that, but it might be something you could try.
Yeah.
You put red pepper on your hands or inside a glove, or what did he say?
Yeah, he was talking about like cold feet. He suggested shaking some into your socks and then wearing them.
How about did he do a controlled study where he took a group and just put socks on them and
I doubt
the socks and the cayenne pepper?
But he has we read him every I get his emails. He's brought that up before. Usually every winter he mentions that. So it's an old one.
Okay. But it seems like it would work in gloves too. I've never tried it. Anyways, worth a try.
Edward, thanks for bringing it up. Eureka would like to pick on the glove. She wouldn't like the pepper as much, I wouldn't think. Ken.
I hate to beat a poor horse to death, but oil. Okay, I thought I had oil all figured out. Listen to you, and I understand it all. And then you just said unprocessed oil. So the only unprocessed oil I know is the oil that's sitting on top of the peanut butter after it sits there for a while.
Well, you also know olives are unprocessed oil. You know avocado is unprocessed oil.
You mean eating it in the whole fruit, not after it's been pressed and heated.
Exactly. You have got, that's the sum up of the whole year's course, Ken.
Well, okay, so I listen to NPR all day. Well, as I sit in the car or travel, and the Procter & Gamble product Metamucil is just really hammered into the listener, and they say it's psyllium, a plant-based product for the fiber to make your well, they don't use the word bowels, but that's what they're talking about. And every time I hear the commercials, I think of Dr. Ross. Get it from plants. I hope that's a great way to end the year.
It is a great way to end the year. Run.
I just wanted to say that sunflower seeds, they have a lot of oil. I have tried it in cooking and in cereal and in bread. And it seems like you added oil, but all you did was add sunflowers, whole sunflowers. So that might be a good thing.
Sunflower seeds do have a lot of oil in them. The kind of oil, I think, is more omega-6 than 3, is it not, Scott? I don't know, as I recall. So
Yeah, it's good
sunflower
to,
oil is not
and
as
it's good not
healthy.
to, yeah, and it's good not to confuse people. When we're talking about a food, we should just be saying it's high in fat, not oil. I mean, it's so like Ken was bringing up the fat or oil that's sitting on top of the jar of unprocessed peanut butter. Once you stir it, it just integrates in. It's just that was separated out from the peanut. So that's just the natural fat that's in the peanut. So you stirred it up. But when we're talking about sunflower seeds or avocados or olives, those are high fat plant foods. We shouldn't really say oil because it would be oil when you stripped out all the nutrients, all the fiber, and now all you're left with is oil. So now all you're left with is the fat that was in that food, and now it's a processed food, and it's because it's just the oil that's left. But when we're just talking about the oil that sits on top of the jar of peanut butter, if that's not added oil, that's just the natural fat that's separated out of the peanuts, and then once you stir it up, it's just peanut butter. But it's a high fat food, but that's not the same thing as eating oil. So we want to make sure people understand the difference there.
Okay. Good thought.
I hope you guys bring some friends next week and hopefully some new people want to come, and we'll start an introduction class a week from tonight.
Okay. Thank you all for coming.
Thank you.
It's been fun as usual. Till the next time. Thank
Bye.
you, Scott.
Thank you.
See you guys.
New
Good
Year.
night.
Happy New Year,
Happy New
everyone.
Year.
Happy New Year.
Thanks. Bye.